All right, it looks like we are now live streaming. So good evening, everybody. Thanks so much for joining us. I'm Laura Buchanan. I'm a family med doc and metabolic health practitioner. And I am excited for Journal Club this week. We're having a guest speaker who I'm very excited to introduce, Kelley Sauber, and she is a certified exercise physiologist and wellness coach in Norfolk, Virginia. She helps people with metabolic disease who are frustrated with their current lifestyle and lack of energy, and who want to make sustainable lifestyle changes to return to optimal health. And tonight she's going to be talking to us about Parkinson's disease. So we're very excited and thanks for coming.
Thank you. I'm really looking forward to the presentation. I hope it's new information or at least something a little bit additional to what you already know.
Absolutely.
Yeah. Are you ready?
Yeah, let's go.
All right. Let me go ahead and share this.
If anyone has questions, please feel free to put them in the chat and we'll probably answer them kind of towards the end of the presentation. Looks good.
Good. All right. So you may be wondering why I'm talking about Parkinson's disease here in an insulin resistance group, but I encourage you to keep your curiosity peaked, your vision horizons wide. I'm about to show you the link between insulin resistance and neurological diseases like Parkinson's. This whole idea came about while I was working with a Parkinson's client and noticed that his disease was much different than my father-in-law's, and he was declining much more rapidly. And as I searched for more information, I also found similarities between their spouses that you may not necessarily have connected. But I did because of my education journey and the journey that I took personally in low carb over the past 5 years. I'm going to set up a description of Parkinson's disease first with a background of the basic brain function, followed by some dysfunction. Then I'm going to discuss briefly.
Sorry, Kelley.
Yeah.
Did you hit new slide?
I thought I did. So let me try this again. How's that? Nope. Oh, it didn't advance. Why did that not advance for me? Interesting.
Kelley, are you hitting that?
Bye-bye.
Hi. Are you hitting that slide inside Zoom or outside Zoom?
Outside of Zoom.
Oh, okay.
Thank you.
Let me see.
I'm getting technology help.
Okay.
All right. Laura, could you unshare for me, please?
Yeah, absolutely.
What's the matter?
I was having my own technical difficulties last week, actually. So maybe it was 2 weeks ago, but if it doesn't work on your side, I could share the presentation as well, but you just let me know.
Laura, that's a good solution. Kelley can just ask you to advance the slides.
Yeah, however you'd like to.
Yes, please do that.
Okay, let me make sure. All right, and if you want me to skip one, I know it could have. Just go ahead, let me know, and we'll go.
I think I'm good.
Okay.
think I'm good. I was trying to click the wrong slide. So am I still sharing?
Oh, I can let you share. Was sharing, but if yours is up and running, you
Well,
want to go
yeah, then I'll
again?
have control. Yeah,
Yep,
it's all good. Thank you. I apologize.
no worries.
Yeah. There we go. Okay. Anyway, back to
Looks good.
my table of contents. So, as I was stating, I'm going to set up a description of Parkinson's disease first with brain function and followed by dysfunction. Then I'm going to talk a little bit about the standard of care for people with Parkinson's disease. Then I'm going to challenge it with new research that's out there, briefly discuss that. And my favorite is the N of ones. So anecdotal, and then also a couple N of ones that actually have been published. I want to provide some foundational information by discussing brain function and dysfunction first. The background of what is physiologically happening in the brain. While contemplating the wide degree of differences between my father-in-law and my current client, and knowing there has to be a connection, I read this book, Georgia Edie's Change Your Diet, Change Your Mind. And the brain's demand is a massive 20% of what the body's total intake is. This is 10 times normal than what you would expect, considering the relative size, 3 pounds, compared to the body. The brain is only 3 pounds, but it takes 20% of the energy. For optimal energy metabolism, the body also requires micronutrients, vitamins, and minerals to influence every step of the metabolic pathway. Now, the numerous times that I have been introduced to the metabolic pathway, it's been a little overwhelming, and I just kind of chalked it up to magic. But the description that Georgia put in this about the metabolic pathway is on point. So I highly recommend that people read this. Now, here's a little synopsis of what she had to talk about. All cells have a two energy system pathway. So there's two ways that our bodies can produce energy, anaerobically and aerobically. So anaerobic is without oxygen, aerobic is with oxygen. In the anaerobic glycolysis, she calls it engine G because it uses glucose only, and it produces ATP, which is the energy molecule, without the use of oxygen. So what happens is inside the cell, the anaerobic glycolysis chops a glucose in half to produce pyruvate and ATP. This is a very inefficient pathway. It yields a very small number of ATP in a short term. So think about when you do something really quick and hard, like a HIIT workout or do a sprint, you run out of energy very fast. So that's anaerobic exercise. It is short term, very short lived, but it does produce ATP very fast. Now you have the aerobic glycolysis, the one that uses oxygen. Georgia Edie describes that as engine M because it involves a small molecule or a small organelle, called mitochondria. Some of you may know it as the powerhouse of the cell, taking you back to high school biology. Aerobic glycolysis produces ATP, an abundance of ATP with the use of oxygen. So pyruvate enters an organelle called mitochondria, and inside the mitochondria is a system called the electron transport chain, which breaks down that pyruvate into acetyl-CoA, another enzyme, and ATP, lots of ATP. Or inside that mitochondria ketones can enter and the electron transport chain and produce lots of ATP. Here's a fun fact, and I'm not going to really go into this because it gets weedy, but it takes 13 steps through these two processes, these two glycolysis. It takes 13 steps to break down glucose. It takes 3 to break down ketones or beta hydroxybutyrate. I found that fascinating. Now, in order for brain cells to receive the raw materials to produce the energy required, those nutrients must cross what's called the blood-brain barrier. Now, the blood-brain barrier is an overprotective network consisting of microscopic capillaries that crisscross all over the brain to deliver valuable nutrients to the cell. At the same time, it prevents risky molecules like toxins or other invaders from entering. The endothelial cells, so the inner lining of the brain capillaries, of those capillaries I just mentioned, create a leak-proof seal with tight junctions. Plus, there are pumps and transport channels that control which molecules can enter and exit the brain's environment. Now, for as sophisticated as this sounds, it is also very fragile. The blood-brain barrier can easily be violated with today's destructive nutritional choices that promote excessive oxidative stress and inflammation. Now, here's the connection. Brain glucose, so the glucose that floats around in the brain up there, mirrors that of your blood glucose, what's floating around in your entire body. The higher the blood glucose, the more the blood-brain barrier will allow it to pass through the brain. Remember, that's about 20% of your blood glucose. The higher the blood glucose, the more insulin is needed to balance the volume back to a resting state. And by the way, that's only about 1 teaspoon at any given time is where homeostasis, or where your body likes the amount of blood glucose, is about 1 teaspoon. Now, we know the story of insulin resistance in the body. You've probably done a lot of the studies through the app and listened to a lot of the videos, maybe other videos as well. But the brain yields a different scenario here. Body to brain insulin levels are inversely proportional. The insulin receptors on the blood-brain barrier can also be insulin resistant, refusing to grant insulin passage. The higher the blood insulin, the more resistant cells become and the less insulin that gets through the brain to access glucose for fuel. So the result is a brain swimming in glucose with little or no fuel to function. And it's got a term, cerebral glucose hypometabolism. And PET scans have shown that the more insulin resistant a person is, the less glucose the brain can utilize for fuel. The hippocampus, which is the learning and memory center, you can see it, I highlighted it there so it was easier to track, is the first to take a severe blow from insulin resistance. It's located deep in the brain structure, housing special properties that make it vulnerable for insulin resistance. So insulin resistance actually inhibits neuroplasticity, which, because insulin is unavailable for dendrite growth and energy to let it function properly. So this cascade effect of insulin resistance leads to difficulty learning new information and remembering current events. So thinking about someone that has some memory issues, they may not be in dementia or Parkinson's or Alzheimer's, but maybe you forgot where you put your keys or whatever. it is because there's not enough insulin in the brain to grow new memory. Another dysfunction for the brain is amyloid plaques. So the brain releases amyloid peptides, or a protein, for protection under stress. Now, in a healthy brain, insulin takes part in helping to rid the excess protein. But if there's insulin resistance, the brain lacks sufficient insulin to remove those proteins, and it creates an ideal environment for plaque to form, for those proteins to clump together and form into these plaques. Another one is tau proteins. Some of you may have heard the neurofibrillary tangles. So that's caused by this tau protein. Now, tau, it helps maintain cell infrastructure up in the brain. It helps maintain those nerve cell structures. When the protein doesn't stay in place, they clump together to form these neurofibrillary tangles. So when tau plays out of position and can't get back into position because lack of insulin, it causes brain dysfunction. Insulin works to keep tau in place, but with low levels, tau can become a toxic heap. Now, the plaque and the tangles are all outside of the brain cells. This next one I'm going to talk about happens inside the brain cells. Now, there's not a lot known what causes Lewy body, but it happens inside the cells. They're also called inclusion bodies, and it's an abnormal aggregation of proteins, as I said, inside the nerve cell, inside the confines of the nerve cells. These proteins develop in about 10 to 25% of dementia cases and are found in most, not all, most people with Parkinson's. Unlike plaque and tangles, the cause of the Lewy body is still unknown, and the medical community can diagnose this according to the symptoms that people exhibit or on early onset. So if someone has Lewy body dementia, their early signs are cognitive symptoms and actually visual hallucinations. Now, someone with Parkinson's and Lewy body, their early symptoms are movement disorders, but they also later progress to cognitive and memory. The Lewy bodies for people with Parkinson's, the Lewy bodies are found in the dopaminergic neurons of the substantia nigra. So they're in the dopamine producing section of the brain called the substantia nigra, which I'm going to mention here. So Parkinson's, our brain and body are very interconnected, and understanding these complex relationships can lead to an understanding in both neurological and metabolic health, and those are tied very tightly. Parkinson's disease specifically is a neurodegenerative disease of the central nervous system that results in dyskinesia, which is an uncontrolled or involuntary muscle movement, the tremors, rigidity, gross movement as well, and other non-motor symptoms such as constipation, dementia. People may have sleep disorders, balance definitely, mood disorders. And all of those are measured upon diagnosis of someone with Parkinson's. Scientists have pinpointed the damage to the substantia nigra region of the brain, which houses the production of dopamine. Now, dopamine is a transmitter that talks signals between two different regions of the brain to coordinate movement. If the brain lacks the dopamine, the individual is unable to control their movement. Currently, scientists have given credit to genetic factors and toxic exposures that cause Parkinson's. The toxic exposure could be a number of things, but it also includes like a blow to the head or some kind of injury as well. Now, remember when I said the hippocampus, the learning and memory center, was the first to take a severe blow from insulin resistance? The substantia nigra sits right beside the hippocampus, right beside it. Parkinson's progression was categorized in 1967 into 5 stages. And this has been the standard of, not diagnosis, but the standard of visualizing and documenting progression for people since then. So stage 1, during this initial stage, the person has very mild symptoms. Generally, they don't interfere with daily activities. There might be a tremor, and if they do have one, it occurs usually on one side of the body. There's a beginning stages of changes in posture, walking, and facial expressions. Now, generally, stage 1, this is the 10-year mark. People tend to stay in this stage. Stage 2, symptoms start to get worse. A tremor, rigidity, other movement symptoms on both sides of the body or somewhere in the midline. Walking problems because of more poor posture become more apparent. The person can still live alone, but it might take their activities, their daily activities, it might take them a little bit longer to perform. Now, stage 3 is considered that mid stage. Loss of balance starts. That's usually the hallmark symptom that says, hey, they're at stage 3. Falls become more common. Motor symptoms continue to worsen. Functionally, the person is somewhat restricted with his or her daily activities, but they can still lead an independent life. Stage 4, at this point, symptoms are fully developed, severely disabling. People need a lot of help with their daily activities and really should not live alone. And the final stage is confinement to a wheelchair or a bed. The standard of care, how are these people being helped? This hasn't changed for decades, decades. So in medical treatment, there's a lot of different medicines, but they pretty much are medicines, one chasing the next, from levodopa, which is the one here on the right. So the other ones are helping the levodopa. So I don't want to get too lengthy on those, but I do want to say levodopa is it's a chemical building block that helps your brain make dopamine so that the tremors and the movement coordination is a little alleviated. The other ones are helping to aid the levodopa. So there's the medical treatment. Once medicine really stops working, people then may opt for DBS or deep brain stimulus. And this is a surgery that what takes place is a pulse generator is placed on like a pacemaker right under the skin in the chest. And then probes are put into the brain, into the affected area of the brain. When the pulse generator is switched on, the electrodes deliver a high frequency stimulation to the area. Sounds a little scary, but I have seen videos, not in person, but I have seen videos where this is amazing and it works really well. Now, the medication and the deep brain stimulus are not cures. and that's constant monitoring, and it is constant adjusting these devices to help the person deal with their symptoms. Nutritionally, more often than not, these are the two diets that are recommended by their physicians: the Mediterranean diet and the MIND diet. So the Mediterranean diet, as you probably know, is based on fresh, unprocessed foods that are low in fat, especially saturated fats, lumping together meats and sweets for a grand total of 5%. It touts 35% whole grain calorie consumption and only 10% unsaturated fat. Now, I assume the percentages means a total calories. These recommendations are really pretty simple to follow for most people in terms of the guidelines following through. Now, the MIND diet is a mash between the Mediterranean diet and a DASH diet. So the DASH diet stands for Dietary Approaches to Stop Hypertension. So basically, it's a reduced salt, reduced sodium diet plan. Again, these guidelines are simple to follow. You eat many more items from the encouraged list on the left and less of the foods from the limited list. So those are pretty standard. A doctor can just hand you a piece of paper and say, here, do this. And the last therapy suggested is the exercise. So because of postural problems and rigidity and the tremors, people with Parkinson's generally become inactive. And this inactivity just exacerbates problems. So, and it decreases quality of life, and it increases risk falls by being physically inactive. So by improving muscular strength, balance, range of motion, increasing walking gait are all important targets to consider when planning. Now, the listed programs that are up here are just a couple of the programs, or a few of the programs that are currently used today. I've actually seen them in action, and I actually use the LSVT Big for my client. But the LSVT began with the Lee Silverman voice treatment. So this was in 1980 when family members of Mrs. Silverman stated to their therapist that they could only hear her because vocal cords are also affected by Parkinson's. And at that point, the speech therapist that was working with them started to developing exercises in hopes of strengthening the vocal cords. And while that was happening, they did see results. A physical therapist said, wait a minute, we can do this also for movement. So about a decade after LSVT Loud was developed, LSVT Big was developed with the mindset to help Parkinson's patients move more normally. So basically what happens is you encourage grosser movement from them. So take activities of daily living and make them bigger movements. So rather than just kind of reaching up close to the body, you would reach out big and wide and then bring everything back in to mimic those daily movements on a larger scale. And then that would take the person maybe back to a normal movement pattern outside their normal close, tight-knit pattern. It actually works quite well. I don't know how long it lasts. When I work with my client on it, he gains significantly improved walking gaits after I do a little bit of big exercises with him. But I don't know how long it lasts. And the last one, this one looks fun. There's a lot of different benefits from rock steady boxing. It's what it is high intensity exercise. And it's backed by research from the University of Indianapolis School of Physical Therapy. The premise is that it's forced or intense exercises, that it stimulates neuroplasticity and normal brain function for the participants. Boxing is used because it is high intensity and it involves gross motor movement outside the normal range. So it's kind of LSVT big too, incorporated with high intensity. It decreases rigidity, which is typical. But the other thing that it does, you do this in with groups. It's group exercise. So the participants also get that social interaction as well. So I do like these exercise therapies. I think they have a place in people with Parkinson's. So current work. This person is currently my Parkinson's research hero. Melanie Tidman is an adjunct professor at Liberty University here in Virginia. And she also is AT Still University. So she is fully remote at this point. She teaches in the health sciences, but her biggest work is studying lifestyle for people with Parkinson's. And her studies are funded by the Colorado Parkinson's Foundation. So, which is wonderful because she doesn't even live in the state of Colorado. So her first bit of work at the effects of community-based exercise for people with Parkinson's was to look for, of course, statistical significance in motor and non-motor symptoms. Her participants were measured pre and post for 8 weeks and measuring the motor and non-motor symptoms, balance, cognition, sleep, activities of daily living, and quality of life. The participants participated in 2 to 3 sessions a week. Post-test revealed that there were no significant improvements in measured outcomes. None. However, participants' self-evaluation reported improvements in exercise, the desired exercise, and social motivation. So I thought that was interesting. Her second study, it was just published sometime in 2024. It was on the effects of a ketogenic diet on the symptoms of Parkinson's, anxiety, and depression. Again, she was looking for statistical significance in motor and non-motor symptoms, disease rating, depression, anxiety, anthropometric measures, and the participants, of course, were measured pre and post of a 12-week session. They were taught a ketogenic diet consisting of 152 grams of fat, 75 grams of protein, and 16 grams of high fiber carbohydrates, totaling 1,750 calories a day. At least once a week, these participants received coaching, like you are, and they were met virtually to ensure compliance. So the study's main finding were significant improvements, 5 of the 8 tested biomarkers. Their PAS scores, anxiety, as well as motor and non-motor symptoms all had significant improvements. So that led Melanie then to her third and current test or research. She is taking ketosis to the next step, and her current work includes MCT oil, medium chain triglycerides. So in this, I can only tell you about the setup. The first 4 weeks, the participants did foundational documentation on their Parkinson's lifestyle, maybe their symptoms. They probably took them all through the test. Then followed right into a 6 weeks of remaining with their typical lifestyle and adding 5 tablespoons of MCT oil throughout the day. So they didn't take it all at once. It was spread out, a tablespoon at a time throughout the day, or however they could tolerate it or need it. After that 6 weeks of that with the MCT oil, they had a 4-week washout period where they went back to their foundational lifestyle. Then the last 6 weeks, she taught them a carbohydrate reduced or restricted diet and added the MCT oil. And she doesn't have any results yet, but she's my hero in doing this wonderful study. And she did tell me a little bit about one particular person, and I'm not gonna mention it, but she did talk to me about it, and it was very favorable. And he almost didn't finish the study because he didn't want to do the washout period. Let's just say that. So other studies, metformin. They're showing metformin is helping to reduce the symptoms of Parkinson's disease. So what it's seeing is that the metformin, which is blood sugar reducing medication, it suggests that there's some mitochondrial improvements with the metformin. However, what I did see is that there was a dose response issue with using the metformin. The lower the dosage had more positive prodromal or at following meal outcomes, where higher doses exacerbated the Parkinson's symptoms and shortened earlier stages for people with Parkinson's. So, and I think I did remember reading a metformin study where people that were diagnosed with Parkinson's and they were still taking metformin, that as their dosage got higher, that 10-year stage 1 span really shortened. Intermittent fasting is shown to target mitochondrial function and improve it. It's shown to decrease oxidative stress and enhancing a therapeutic response for people with Parkinson's. In a pilot randomized control study comparing low fat versus low carbohydrate diet, both showed improvements in all biomarkers. However, the low carb ketogenic diet group, their markers were better over the low fat. And a 2020 study was instigated when a researcher became curious about the effects of ketone esters on people with Parkinson's disease and exercise performance. In previous studies, ketone esters were shown to marked improvements for elite athletes and improving their performance. Could the ketone esters work for people with Parkinson's disease? And it does seem to be positive that it does help them sustain moderate exercise longer. But again, more study needs to be done with ketone esters. And the curiosity, the N of ones, Melanie, this is before and after results from an N of 1 53-year-old male in 2022. She coached this person on 70% fats and 25% protein and 5% carbohydrates, and it led to significantly improved health biomarkers, including A1C, C-active protein, triglycerides, fasting insulin, waist circumference, weight loss, cardiac ratio risk, which is triglycerides to HDL. And for him, there was improvement on the anxiety scale as well. What this case study, this N of 1, suggests is that the ketogenic diet is safe and effective, and she encourages that there's future trials with more people are needed to get more results. Here's another N of 1 that Melanie sent through, and she had the same, it was basically mirrored from the 53-year-old man. This is a 68-year-old female, and she had marked improvements, even include over 24 weeks. So the significant improvements. I just look at those triglycerides there in the middle, right in the middle of the list, and look how wonderful those dropped. Yeah. And the last N of one that I want to mention and really encourage you to find this man. He is on YouTube. He did document in person taking MCT oil, also taking ketone esters, the before and after. And I think it took like maybe an hour for the MCT oil to kick in for him. But William Curtis, he's from Maryland. He was diagnosed with Parkinson's in 2004. And at that time, he was sentenced to 10 good years. He was in stage 1. And he's like, oh, no, this is not happening. So he left the doctor's office and went right to his local library and started research. And his first connection is connecting the dots was with exercise and the brain by reading a book called Spark. And from there, he dove into the effects of fasting while exercising, and it determined he had great success with it because of the ketones fueling him. He figured that out, those dots. So then William came up with a routine, and it's listed right here at the bottom, with a routine that works very well for him. And he has documented this with several published works. And his conclusion is that he wants to see further studies with this, using these 5 steps. So he gets up in the morning and has a buttered coffee, which has coconut oil. He doesn't use MCT. He uses coconut oil. So it's coconut oil, butter. He puts some flavoring, some stevia or some kind of sweetener in it. And then he shakes it up and he drinks it. Followed shortly by a couple hours later, he takes ketone esters and he fasts the whole way till lunch. That's his first meal. He avoids carbs, any excessive protein. There's an issue with that because of his L-DOPA. And then he fasts after dinner. It looks like from this, he only has 1 meal a day, but I'm thinking he has 2. And then he fasts again until the next day. And he has this documented. He doesn't have a lot of videos, and they are very short, but they're incredible when he does his, he shows his tremor, his posture, drinks his coffee, and then comes back on an hour later, and he looks like he's back in stage 1 of his Parkinson's disease. That's a lot of information. It's all new, and it only led me to ask more questions. So there is marked improvement for people with Parkinson's disease with the MIND diet. My question is the improvement simply due to the removal of processed food and eating more whole foods? Will this recommendation help with other neurological diseases? In other words, will it help with Alzheimer's, ADHD? We know ketogenic diet works very well for reducing and removing, help me out here. Oh,
improving symptoms with Alzheimer's. There's there has been some pilot trials and small studies for sure.
Seizures, that's what I was.
Okay.
Epilepsy.
Yep,
Yeah,
a lot of data.
I knew as soon as I would break my train, it would come to me. So Georgia Eadie's explanation of brain function versus dysfunction, and I understand. Now we're talking brain here. I understand that the anaerobic glycolysis only use glucose. So ketones are out of the equation here. But with aerobic glycolysis, so needing the mitochondria, engine M, if ketones save the day for so many chronic diseases, doesn't it seem logical that ketones are actually the preferred fuel for the mitochondria? Would this make the brain crave ketones over glucose? and this is my biggest one because it is about the brain. Why would an organ, the brain, derived of 60% fat prefer glucose as fuel?
Some great questions. Look forward to hopefully we find the answers.
Thank you.
Yeah.
Thanks, everybody.
Yeah. And thank you so much. That was awesome. And I wanted to jump in real quick and add, because I think, like you mentioned, the MIND diet has shown some benefit in that low fat, low carb trial. And you pointed out the low carb had even more benefits than the low fat arm. There was, it was actually within the part one of the questionnaire, which is looking at behavior, mood, mentation symptoms. It was a 40% improvement with low carb compared to a 10% improvement with low fat. So both helped, but really the low carb had a significantly higher benefit to those people. So I definitely need more larger trials, but I think that's very likely ketones, like you were just talking about, playing a role there. But clearly even low fat in a very healthy diet, they remove processed foods and sugars, was also effective.
Right.
Awesome.
Okay. Should I unshare to ask
Oh, yeah.
questions or
Yeah,
okay.
do that. So everyone, please feel free to jump in and ask questions, and I can also try to answer some. Someone asked if there's a connection between Parkinson's and essential tremors. There does seem to be a slight association with if someone has an essential tremor, they're at a little bit of a higher risk of developing Parkinson's compared to the general population. It's not a huge risk, so it's definitely not. There are much more people who have an essential tremor that do not go on to develop Parkinson's disease. Other questions?
I had like a two-parter. I was wondering, is there any way to like check to see if you were like predisposed to the Parkinson's early? And the second part of that question is, if you were to, be lucky enough to catch it really early on, you would discuss like the importance of exercise. Can exercise kind of prolong the stages as you go forward if you catch it early?
So to answer your question, scientists have found a gene, and I am sorry, it's escaping me now. I've heard it numerous times, but Laura, do you know what the name of that gene is?
I don't off the top of my head.
And I have, so there is a gene, but you don't necessarily have to express that gene. You may have it, but you don't necessarily need to express it and by keeping a healthy lifestyle. So there's that. And the second question was, what was that again, Brian?
If you catch it really early on, like at the beginning stages, and when you're able to get to in an exercise routine and everything, can that kind of delay the progression of Parkinson's?
So as with any exercise, it is important. It's important for your muscles. It's important for your joints and your bones. But exercise is not meant necessarily for weight loss. But I don't think exercise alone is going to do any preventative measures for Parkinson's or any neurological disease. It's truly wrapped around lifestyle. Will it be beneficial? Yes. I do believe that the range of motion, the big movements and the HIIT movements help reduce the blood sugar and hopefully will help lower insulin. But if you chase it with a bad diet, it's going to be futile. But the big movements, the LSVT big and loud, are really important to maintain that range of motion and hopefully stave off some of the rigidity. But again, if you're chasing it with a bad diet,
right.
Yeah.
Yeah. And how much of your presentation is in the opening book? I think they're referring to Georgia Eads, Change Your Diet, Change Your Mind.
So the engine E or G, engine M come from her book. The blood-brain barrier information comes from her book, and just the way she describes the metabolic process through the electron transport chain was wonderful. So I do like to reference that because it gave me a visual to help me take the magic out of it.
Yeah, it is a really good book. I think it is definitely worth reading.
Right.
What are ketone esters?
Ketone esters are, well, there are several different types of ketones, and ketone esters are made up of the beta hydroxybutyrate component of ketones, which are the ketones that you use to create that energy. So it's a supplement, really. It's a supplement that gives you ketones right now. Your body doesn't have to produce or make any of them. So you get them, you drink them basically, and your ketone levels go up. However, I just am experimenting with ketone esters, and my blood ketones did not go up. They did not go up. It is very interesting. So I'm on the fence with it. I wanted to try them just to see, but that's supposed to be what happens. So there's another way to take exogenous ketones, and that's with ketone salts. So it's a little less concentrated form of ketones, still the beta hydroxybutyrate, but it mixed with electrolytes, basically, in a liquid form. Yeah.
Yeah, and I think kind of what you were saying with if you're eating a standard American diet and then you try to take ketone esters to help get your ketone levels to improve your symptoms, you're really not going to be doing yourself any favors, probably won't see a lot of benefit. The ketones that we're getting a ton of benefit from, a lot of that is likely happening from improving your own mitochondrial function,
right, and
removing a lot of the unhealthful things about kind of the processed food and the other things we're eating. And so,
yeah, and what I just recently learned, because I'm not a supplement person, and I don't like that. However, in my research on ketones, period, whether they're esters or the salts, is that the people that are researching exogenous ketones are thinking that taking these ketones in whatever form is going to enhance the body, maybe heal or improve or increase the amount of mitochondria that you have. So basically getting healthy mitochondria in the body, and so which would be beneficial. So it's more of a short-term benefit to use them to help boost your metabolic, not necessarily just right now, but in the future, it just improves the metabolic function, the mitochondrial function. So that's why I'm trying it, to see if it works.
Yeah, cool. And then someone asked, are there benefits to ketone esters and MCT oil in those with Parkinson's?
I've seen conflicting readings on whether or not you should have some type of oil, MCT or coconut oil, in addition to ketone. One person says use them, another person says not. I only saw don't use them together, but the reason people encourage them to be used together, and there are actually some supplements that have them combined in one drink, but is that the MCT oil helps lengthen the effect of the ketones. So it transfers. So you burn those ketones immediately, but you're in ketone burning mode. So it just pulls in those oils too, the MCT oil, for the body to make ketones.
Perfect. Yeah, I think when I was looking, you mentioned Melanie was actually doing a study with MCT oil and some with Parkinson's. So I think there's going to be more research for sure in this area. And that actually reminded me within the past 2 months, Melanie published another paper that was a kind of extension from that 12-week trial you were talking about. There's just 7 people who continued on to complete 24 weeks, and is published in neurodegenerative disease management. But
Yeah.
yeah, it was just came out recently, and but the results were excellent. Kind of same, very similar to the prior. I'll just share my screen real quickly, and show the, but kind of exactly what you showed us across the board. So extending out to, again, 24-month trial here. All of the things highlighted in red were statistically significant. You had motor symptoms improving, anxiety scores improving, and significant improvements in weight, BMI, triglycerides. And then the other thing, which is also just really important, is the kind of the people's experiences, what they noticed, and family members. Someone who had significant joint pain, had 50% of it went away with the ketogenic diet. Talking, speech improved, less brain fog, attitude and emotional outlook improved, cognition, vocabulary, and thought processing. So just kind of reiterate, it's sustainable, and people having wonderful improvements with their quality of lives and motor and non-motor symptoms. So awesome. Well, any other questions? I think we have come up on the hour. So thank you so much, Kelley, for giving that
Oh,
talk.
you're welcome.
Awesome. And
This was fun.
Yeah, it was great information, and looking forward to hearing more and learning more.
Very good. Thank you, everybody.
Thank you.
Have a good night. Bye-bye.
Bye.